Okay, so we're gonna start by looking at your external nose and looking for any sores, asymmetry from side to side. And now we're going to look at your internal nose, if that's okay.
Sure.
So I'm gonna take my light here, I'm gonna turn it on, make sure that it's on. And what I'm gonna do is I'm gonna stick this in your nose and have you tilt your head back just a little bit. And I'm gonna be looking for color changes, looking at your turbinates, mucosa, and looking for any blood or extra discoloration, okay? Alright. Everything looks good, and I'm also going to be looking at your internal septa. I looked at your internal septa to see if there's any deviations. Okay, and I'm going to take this off, and then now I am going to do your sinuses. I'm going to check your sinuses. I'm just going to feel. Let me know if there's any pain with that. Okay, so I'm going to feel the frontal sinus and these sinuses here. Any pain with that?
No.
Okay, and now I'm just going to tap. Any pain with that?
No.
Okay, and now I'm going to go into the mouth part of this assessment. So I'm just looking at your external mouth, looking for sores, looking for the moisture, looking for some texture if there's anything like that, any sores. And now I'm going to be looking inside your mouth. I'm going to be looking at the inside of your cheeks, your gums, your teeth, the hard palate, the frenulum, and then I'm going to be looking under your tongue, and then just looking at your teeth and gums overall. Is that okay?
Mm-hmm.
Okay, and then when I'm done, I'll let you know, and I'm gonna just depress your tongue and I'm gonna have you say ah, okay?
Oh.
Okay. So I'll take my light, and I'm just gonna push down on your tongue, okay? And I'm looking at the inside of his cheeks, looking for discoloration, bite marks, looking along the gum line, teeth, shape, looking at the top. Good. Okay. Now I'm gonna have you kind of depress your tongue here, and I'm gonna have you say ah. And I'm looking for asymmetry of your pupilla or your uvula and your you can close your mouth, and your tonsils to be moving, and they were. And now I'm going to have you open your mouth, and I'm just gonna touch the back of your tonsils to see if there's a gag reflex. Okay. Okay. Put your tongue down. Say ah. Okay, my patient's super cooperative. Okay, so we did that one, and now lastly, I'm gonna have you stick your tongue up like this. There you go, and I'm just looking at your frenulum and looking for a tongue tie and how long it is. And then the final test I'll have you do is I'll have you stick out your tongue like this, with your lips closed. There you go. I'm looking for a deviation from side to side for cranial nerve 12. The gag reflexes for 9 and 10, and his results were good, as long as also his 12 was good as well. Okay, that's it.
So bad.